I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and recently I was asked about focal asymmetry. And someone asked me, if I have focal asymmetry on a mammogram, why do I need to get another mammogram and an ultrasound to figure out what it is? Why can't I come see a surgeon like you directly and just have it cut out? This is an example of focal asymmetry on a mammogram, and you can see in the red circle, the tissue just looks a little different from the corresponding area in the other breast, but it doesn't look like a distinct mass. This area is pretty small and would be able to be cut out if someone really wanted it out, but I haven't seen any patients who want to have their focal asymmetry removed after I explain it to them. Here's another example of focal asymmetry, and you can see that the tissue in the red circle just looks a little different from the corresponding area on the other side. This is a larger area and would be hard to remove and still leave the patient with two breasts that are the same size. Focal asymmetry is really common after a mammogram, and it's a common reason to get called back in for additional mammogram images as well as an ultrasound. But only about 2 to 6% of focal asymmetry actually leads to a breast cancer diagnosis. So the vast majority of this ends up being clear, meaning that when you get that diagnostic mammogram, they see that there isn't a breast cancer hiding in there, or when you get the ultrasound, they see that there isn't a mass right there. So most focal asymmetry doesn't need to be removed because it's not cancer, and it's not often something else like lobular carcinoma in situ or a radial scar, which could warrant removal as well. It is really scary to see those words on your mammogram report, and it is terrifying to be called back in. But my recommendation to my patients is always to complete the workup and see what's going on in there first before deciding to remove a part of your